of an Ebola outbreak in the country and the protection of health workers. This is after several cases have been reported in neighboring country Uganda, and they fear the disease spreading in the country.
Districts in Uganda reported cases of Ebola. The Kenya Union of Clinical Officers, KUSO, has said the Ministry of Health has not made preparations to prevent the possibility of the disease spreading in the country.
The phase we are in is prevention. Prevention from importation, because we don't have Ebola in Kenya as of now. But we are vulnerable owing to the fact that we interact with the country where that disease now, we are having an outbreak.
According to the national chairman of KUSO, Peterson Washira, health workers are at a risk of contracting Ebola since there are no strategies prepared by the government to protect health workers. Washira has said, considering the close proximity of Kenya and Uganda and the porous borders, it is very easy for the disease to spread in the country.
We know the spread, and most of the times starts from the hospital. When that one case presents to a healthcare worker who is infected, and before you can know that they're infected, then they infect the other health workers, they take back to their families, and that is how it actually spreads. And that is why we are saying, on the side of the spread through the health workers and through the community, we are actually not doing anything as of now.
Secretary General of KUSO George Jibore has said their survey in 10 counties has concluded that health workers in these counties are not yet protected from the possibility of being infected by the Ebola disease, and has urged the county governments to also put strategies to prevent the disease from spreading.
That healthcare workers have not been sensitized on infection prevention control measures, case management, and sample management. 2, that health workers manning triage and consultation rooms are not provided with the requisite PPEs. That communities in the above mentioned counties have not been sensitized on how to identify any Ebola suspect cases.
This is after the case that had been reported on September in Kakamega County, where one person was suspected to have contracted the disease after traveling from Uganda. Before it was later discovered he was not suffering from Ebola, and the Ministry of Health announced 20 high-risk counties. Edin John Mukora, Look Up TV.
You're watching the news on